wouldn't.
No,
you would not. Nobody would.
If I had it.
If I could wait till I'm sick, well, I'm not sick now. I'm sick now. Now I'll buy the insurance. Hello? This makes no sense. The answer is you would not buy insurance if you are well. You wait till you're sick and then you buy it. Well, that's what the problem with the uninsured is really about. This stuff about the uninsured being victims, that's malarkey. Yeah. They're viewed as villains. Why? Because they're not paying into the system. And if you're going to insure all these uninsured people and subsidize their coverage, you've got to go get the money someplace. And if you have a system in which all the well people are not participating and only sick people are in the system, the premiums are going to go even higher. So those uninsured people must be brought in. That's why there is a mandate. That is why you will be fined and punished if you don't have health insurance. That is what is going on here. It makes no sense economically. It makes some sense politically, which is why they're doing it. Because it arrogates more power to the government at the expense of the individual. That's what's really driving it. They don't understand, maybe they do understand the economics, which makes it worse. But I think they don't, but they do understand the politics. And the politics is more power for the government, less power for you. That is what is going on here. Enough of that. We could talk about many other topics. This little book by Chris Warden, who is a wonderful person. I worked with Chris off and on, and with Malcolm for how many years, Malcolm? About 10 at NJC, National Journalism Center, where we tried to teach economics for journalists, just as Chris does in this book. I then was a teaching colleague of his down at Troy, and when he very sadly passed away last year, I taught some of his classes to finish out the semester. He was also a practicing journalist. He wasn't just a professor. He was, as Mal mentioned, for 10 years, or I guess 8 years was it, on Investors Business Daily, and became the editorial page editor of that very fine publication. And he practiced, therefore, what we preached. And the result of that, crystallized his experience as a teacher and a journalist, is this book. So I do hope that you will read this book, buy it, read it, and also my tapes on your way out. But that's optional. The book is what's really important. And Malcolm, I guess that's it. That's my story. I'm sticking to it. Thank you very much, all of you. Malcolm, I'll let you.
Yeah, does anybody have any questions? It's all clear.
I got one.
Preston.
I'm NJC 1993.
You certainly are.
And I had the pleasure of both working with Stan and I don't know if Chris was Chris. Well, I also worked with Chris in Investors Business Daily.
Right.
My question is, and I remember all the things about price controls, and also the example of dollar bikes you gave. How many bikes they made a price control bike with $1?
That's in the book. It's in the book.
My question is, though, when you said that, and I agree with most of what you said, I think I don't disagree with this, but my question is that when you said that, people will, if you ban pre-existing discriminating for permanent pre-existing conditions, people will wait until they're sick to get insurance, and then that will raise rates for everybody else. But what about the case where people, now they don't wait to buy insurance, but they know that if they don't buy insurance because they know if they get sick, they can still get treated, because every hospital has to treat, are required to treat somebody who shows up there. So what are the things you do to take care of that? Do you just...
Well, that is a separate issue, and I do not deny that could happen. There's sort of a free rider aspect to it. However, I separate the two things, because what is really driving this is not that. That's what is said frequently. It is they need to go get the money. They need the money from the people. If you break down, you may have done some of this job, because I know you cover economic issues and cover them very well. And I've done it for years. If you break it down, the uninsured probably consist, and not probably do consist, disproportionately of people in your age bracket. Younger people, young workers. A health insurance policy could cost anywhere from $10 to $12 to more $1,000 a year for premiums. What is the likelihood of somebody in your age bracket incurring medical costs in a single year of $12,000 to $13,000? Probably pretty small. There would be some exceptions, but by and large, not very likely. It is therefore a totally rational economic decision for you not to pay that money for health insurance and meet your expenses such as they may be out of pocket. Doesn't mean you should not at some point have health insurance, you should, but that is what is going on. So, and as the premiums go up and up and up, the logic becomes more compelling for more and more people. That is why in the Massachusetts plan, the Romney Care, which is a sort of pilot project for Obamacare, by the way, people are punished. You are punished. You're fined for not having health insurance. That isn't because they're worried about free riders. They want those premiums because they cannot finance the system without them. In terms of people who cannot, who are by other reasons, and this gets very technical, but they can be insurance pools. They have these for automobile insurance and so forth, risk pools, which can be administered on a reasonably economical basis. But that is not what is driving this. It is the greed for, you ever see these Geico commercials? The googly-eyed stack of money? That's what they're looking at. They say, we want that. What does that money have googly eyes for? Do anybody know what it is? But anyway, there it is. They see that money and they want it. And that's why they want to tax the benefit. That's the other thing they're proposing. Are you aware of that? So you have two classes of people in this country who need to be punished. People that have health insurance and people who don't have health insurance. Leave anybody out? So that you have health insurance. So therefore, we want to tax your health care benefit. Show you. And you, Shaker, you don't have any health insurance. You are a virtual, enemy of the people. And so we would tax you, fine you and punish you and make you have health insurance. Why is this in any way unpopular? What is there about this that would be unpopular? I don't get it. So now, unfortunately, our Republican friends, and God bless them they're good when they just oppose stuff. Once they start proposing stuff, that's where we're going to get the agreement. There are a number of Republican bills that would tax the health care benefit. Did you know that? There are Republicans that say we must cover pre-existing conditions. And if you have pre-existing conditions covered, however that's defined, you must have a mandated universal system to close the exits so that you, young people, cannot escape. That's really what it's about. So this is a doomsday machine. It really is. If somebody sat down and said, how many bad things can we think of that we can put together in one piece of legislation that would completely mess up everybody? You would have Obamacare. That's what it is. There's not one good idea in the whole thing. It's all terrible. And so that's why the Republicans should beware well, we can certainly agree with you on this, Mr. President. No, 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 no. We don't want that. We do not want any such agreement. What we want is we want gridlock is what we want. And yes, I'm not ashamed to stand up here and praise gridlock. Gridlock is the next best thing to having a constitution. Bill Shaker. Yes, Bill.
Stan, you made a statement in the beginning that I'm going to take issue with, I think, and it's very troubling to do this.
Okay.
But you said you didn't believe that the president had read that book.
Of this book.
Yeah, I think he did.
And did the opposite?
I think he read it. Or I think he read it and I think he understands what you're talking about. And that's what's so troubling.
That could be, Bill. I do not, you know, I don't know that he hasn't read it. He certainly acts like he hasn't read it, but it could well be. Well be that he said.
You gotta figure out why he's doing what he's doing, right?
Correct. Okay. Yes, ma'am.
Well, you talked about how it seems that the Obamacare bill is a compilation of everything that would be bad for the healthcare market.
Correct.
Are you proposing in theory that by destroying the market further, it may be more possible for universal healthcare as a positive solution to what happens after, say, an Obamacare system were passed?
I have no idea. I think they want the power. There's ideological commitment to this. It's been going on since you know the 60s at least, and they keep coming back and trying to do the same thing over Hillary Care. I do have some other further, but I'm going to yield to you, sir. Go ahead.
Could that be Obama's version of constructive destruction? What economics you call that? He wants to fundamentally change the system. In other words, create a crisis, replace the system. Could it be?
It is theoretically possible. There is a crisis. It isn't that that was one of the things I disagreed with our Republican friends on way back during Hillary Care. The mantra became, there's no crisis. There was a crisis. There is a crisis. The crisis is caused by the third-party payment mechanism. It is not going to be corrected by more third-party payment. That's the problem. So it's not that there isn't a crisis. But I do think that there's more of a political motivation here and an ideological motivation. It's hard to believe they do understand the econ, although they certainly, you know, it isn't that hard to understand. But again, our side, I think, has done a very poor job of articulating. I think they should be able to, you know, totally demolish Obama. And not, oh, well, boy, he was really good, wasn't he? Boy, he's so smart and so articulate and everything, and we didn't know what to say. Well, it's not good. So we need better articulation on our side. This gentleman right here.
So what is the solution to the current problem to get the price mechanism working again?
Got it. Secret.
Okay,
Tape.
that's secret.
It is so simple. It is so simple. And maybe it's too simple. If you look, the whole thing cannot be solved at once, but most of it can be solved by this method. Employers now in the private job market are paying $8,000 to $10,000 a year in health care costs per worker to provide those workers with health insurance. A lot of money. And it's going up, 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 up. What is proposed, the reason that there's this asymmetry here is that the health care benefit is untaxed. It's an untaxed benefit. The equivalent amount of cash would be taxed in the pay packet. So therefore, and this is in some of these Republican bills as well as in this so-called Cadillac tax in the Obama bill, is well, we need to level the playing field. And there's a lot of Orwellian or Aesopian language used to describe this. One of my favorites is reforming the tax exclusion. Now, that sounds good, doesn't it? It means tax the benefit. And that's what that's about. And so then when you tax the benefit, and this is in these bills, you then equalize the playing field. Well, that's, you know, maybe that's good for Democratic policy, but not very good Republican policy. It'd be a massive tax increase.
Yep.
But the money's there. The googly-eyed stack of money sitting there. And so my solution is to turn it around. Yeah, well, level the playing field. Untax the cash. Untax the cash. And offer that cash. It's the same money. It's not going to have no fiscal consequences for the government whatsoever. It's untaxed now, it'll be untaxed then. But you let the worker decide, do I want a health care policy it's costing $8,000 to $10,000 a year, my employer, which I may not use that year, in which case it's gone. Use it or lose it. But would I rather have $8,000 or $10,000 tax-free cash in my pay packet, which would then be replicated year after year after year, and put it in an account with which you could buy catastrophic or buy any insurance you wanted to, and then as you build it, and then you can spend it for anything you want. The way they do, these are HSAs, but they limit them and constrain them. You in essence, equalize by cutting taxes, not by increasing taxes. Is this so hard to grasp? I don't know. Why don't they say this? And then you could then pursue the same technique with Medicare and even Medicaid. There's a per capita outlay, and this has changed, I'm sure, in recent years. Malcolm, I don't know if you've kept up with this. We used to cover this a lot at the Journalism Center, intensively, believe me. And I remember talking to my then 95-year-old mom about this, who's on Medicare. And I said, you know, there's a per capita outlay for you in Medicare about $5,000 a year. And she never used medical benefits to that amount at all. And I said, Mother, if we voucherized that, you could get that $5,000 in tax-free cash every year. That was as long as the conversation took. She said, when can I get it? My mom, at about age 95, understood that perfectly well. And you can do the same thing across the board. Once you do that, you totally change the dynamics of the system. Because when you then are consuming health care, you're spending your own money. Well, then you've got a totally different ball game, and that introduces all the elements of competition and all the elements of common sense that you have when you buy anything else. I remember, I won't name the name, but I remember a friend of mine had some surgery about 6 or 7 years ago, because it was on insurance. And he said, I was amazed when I saw what the bill was for that surgery. I said, really? He said, yeah, it was like $6,000. It really seemed high. I said, did you ask how much it would cost before you had it done? Well, no. No, because he wasn't paying for it. He didn't ask. I said, well, suppose you bought a Lexus. And he said, I don't know, bring a Lexus around to my house and drop it off, and then send me the bill later. And he said, the bill is $50,000. I had no idea that we cut it. You don't buy anything else that way if you're paying for it, but you will if somebody else is paying for it. So once you voucherize Medicare, you can do it with Medicaid, same thing. You then empower, and it's cliche, the patient, the consumer. That's it. That's the answer. And that would take care of 75% of our problems. It doesn't mean you can take care of all problems. Yes, sir.
So we come here to Washington to not primarily learn about economics, but to change policy.
Well, yeah.
And to influence policy.
Yeah.
And so coming away, what's our takeaway from here? How can we influence policy as it's currently proposed?
If the policy involves any of these matters, you can be a student of and advocate for market solutions, not more government solutions. And if you're working in a Republican office, I presume that's the way that office is bent. The idea would be congenial to your bosses. But I can tell you this, that my experience has been, and I've talked to a lot of Republican congressmen. I haven't talked to many Democratic congressmen about this, but I've talked to Republican congressmen. I talked to the first President Bush about this some years ago. And the difficulty is that nobody wants to pay any attention to it. It's like, I don't do Windows. It's boring. It's econ. Who cares? Go talk to somebody else about it. Put it on a 3x5 card. But don't bore me by talking about economics. That's the mindset. Well, if you then become a knowledgeable advocate and analyst these matters, you can be a powerful influence. And I say this, that the government, and I've been here a long time, the government is run by 25-year-old people. They run the government. People about your age, maybe a little older than you. But about 25 is about the norm. And the reason for this is that when they have the big, long, dull hearings, the congressman is not going to go to those hearings if he's on the committee, and even if he is, he might not go. And the LA isn't going to go there, and the AA service running the office, and they're going to say, let's send Jane. Jane, go to that hearing and take some notes and come back and tell me what happened at the hearing. So Jane or Jack or whoever is sent off, only not much older than you or maybe your age, is going to be the source of information for that office about very important matters. But again, as with journalists, if you understand what the issues are, if you understand what's going on, then you are in a position to interpret those hearings for your bosses and provide them with good information, just as journalists would be if they understood these matters, but of course they don't. And that is our problem. Nobody gets it. Nobody understands it. And so each and every one of you can be miles ahead of other folks in the policy realm if you do get it. And that's why you need to read this book. Yes, sir.
I feel like there's kind of this city, once you cross over the Potomac and you enter the District of Columbia, you've ceased to exist in a place where there's logic, which apparently